Hey everyone, Dr. Charlie Johnson, physical therapist and back pain specialist. In today's video, I want to talk you through a case study of a woman who came to me, was diagnosed with a disc herniation, and how we helped her heal naturally without things like pills, injections, or surgery. So for anybody watching who's looking to get back to normal naturally, call 484-552-3767. All right, so let's jump into this. So here's what happened. This woman bent over, felt something in her lower back, and immediately went the traditional route, which most people do, which is I went to my family physician. They gave me some naproxen, some Flexeril, a muscle relaxant, and then I was told I needed an x-ray. So then a couple weeks later, finally got the result of an image, got in to see a specialist who reviewed them with her, and she was told that the likely cause of her problem, so her diagnosis, was a disc problem at L4, L5. And she was recommended pills to get an injection or surgery, not recommended natural treatment. She was frustrated by this, so she called me up, frustrated, confused, and had a lot of questions. So here's sort of what we talked about. Here's how the conversation went. So she did some research on her own, and which was really cool. What she found out is that the images, they're almost too good in that they pick up everything and anything wrong with somebody. So she said, Dr. Charlie, I read somewhere that that there are a lot of people who have no pain at all and have disc herniations, and that, disc herniations are a very common thing. So what are the chances that they took an image and that's really not the cause of my pain? Well, I said, it's pretty good. And then I said, even more than that, it could actually be a disc herniation. But I said, even more than that, we know that the outcomes for what you've been recommended, taking pills, which leads to addiction and just mask the problem, injections, which can spike your blood sugar, cause other problems, and risk for infection, things like that, and then surgery, which results in really nothing positive in many cases. The outcomes are not very strong for that. So going down to the traditional route and just trying to treat her disc problem, often results in no significant or better outcome than just having natural treatment to begin with, so PT. So then she said, okay, well, if the images aren't that reliable in telling what the problem is, and how do we actually tell what's going on, and then what do we do about it? So that's the more important thing. People think that they go this route and they get a diagnosis, and then there's sort of I don't know, you ever have something happen in life where it's supposed to be exciting and then it's and nothing happens, it's and something just fizzles out, right? So surprise, and then nothing happens. So that's kind of what happens to people. They get an image, they're told this is the problem, and then they're like, okay, now what? What do we do? So how do we treat it? That's all really people care about, all right? So now what I said is we use movement as medicine. So get that these problems are brought on by a movement. So I said, hey, your problem was brought on by bending over and picking something up. So if you brought it on with a specific movement, it's a movement-based problem, then the solution is always that we need to use movement to get you out of the problem, instead of just an image, pills, injections, surgery. So with that being said, I said we're going to use movement as medicine. And the first step for her is I said, first we have to teach you how to put out the fire, how to reduce the discomfort, and teach you specific strategies so that you can feel better, do more of that which makes you feel better, less of that which makes you feel worse, and tip the scale towards healing. So the first step is we have to sort of unload, I'm going to say put out the fire, right? And for anybody watching, a simple way to start this process is to take a piece of paper, and on one side put a frown face, and these are all the things that make someone feel worse. And then on the other side put a smiley face, and these are all the things that make the person feel better. In this case, she said, hey, when I walk it feels okay, when I stand it feels all right, and then sometimes just laying down I feel pretty good. And then on here she's like, man, I can't even think about sitting. What else should I say? Bending, that's how she hurt herself. Driving, she was concerned about whether she'd even go drive in here for treatment. And then I don't want to lift anything. So no tying the shoes, no doing laundry, all those things. These are the things that made her feel worse. And notice that she has, twice as many things that make her feel worse. Big fat thing of things that make her feel worse. And very few things that make her feel better. So the first step in solving any problem is once we know this and we identify this, we have to teach in this case her, how to do less of the things that nick the scab, keep the fire burning, and sort of weigh down this side of the scale. So I said, hey, we can't sit temporarily, or if we do sit, you have to put a towel roll behind your back such that it keeps your back in a better position. And taught her some different strategies there. I said, well, hey, when we bend, we have to teach you how to hinge temporarily, so this way you're not, for whatever reason, rounding the back. It's sensitive. So, regardless of what it is. Driving, well, we can teach you some different strategies there. Her nerve was a little annoyed, so I said we can push the seat 1 inch forward. Again, we can, she was sitting in a bucket seat. So when she was sitting there, she was in a sort of rounded position. And so I said, hey, can we sit on a wedge? So this way, you're sitting up a little bit higher, your back doesn't have to go into as much of a round. And then I taught her some different strategies for lifting. Another thing that bothered her was getting out of bed. So, there's various things. The point is that there's a lot of education that occurs up front because these issues happen for a reason, and once they happen, we have to clean up all of those things such that we can make this dude smaller. That's what we're trying to do. Shrink this person down, put them on a diet. And then how do we do this? So how do we make this side heavier? Well, the next component to treatment is movement. And what we do is we do more of that, which makes this person feel better. So for her, it was walking and standing, but then through a specific movement-based exam to solve this very movement-initiated problem, what we found is that she felt much better when her back was in this position, which that makes sense. When she's walking or standing, her spine is upright. So instead, we gave her, just like a prescription would be taken, we said, hey, you're going to do standing back bends, and you're going to do that 10 times every 2 hours. On top of unloading, doing less of that which makes you feel worse. So now we've shrunk this person by teaching her alternatives there, but then by doing the specific movement of these back bends repeatedly, again, for anybody watching, hands on hips, sticking your gut out basically and feeling a gentle arch in the lower back. Maybe a little uncomfortable, but the more it's done, the better it should feel, and that's what happened in her case. Then what we do is, because we're doing it 10 reps every 2 hours we feed this sucker, and we make them bigger and bigger and bigger until the scale tips towards healing. So that's sort of just a case study of how we've helped this woman feel better, get back to normal naturally without pills, injections, or surgery. Call 484-552-3767.